Have you ever stopped to think that your neck and shoulder pain might not be related to your spine? That's right. Many people seek treatment such as therapeutic massage, chiropractic care, and even surgeries, but end up not getting satisfactory results. In fact, I myself went through this frustrating experience when I started chiropractic school to try to solve my shoulder problem, but nothing worked. Why? Because I was only treating the symptom without understanding the connection between this area of the body and the gallbladder. Just imagine, after years of practice and more than thousands of patients treated, I realized that around a large percentage of neck pain, spasms, and tension in this region do not originate in the affected area itself. The problem is that healthcare often does not consider these connections. But don't worry, I'll show you a simple technique that will help determine whether you have this issue or not. And the best part, it will take less than 10 seconds. Let's begin by understanding the relationship between the gallbladder, the liver, and neck and shoulder pain. The gallbladder is a small sac located under the rib cage, connected to the small intestine and the liver through a duct. The liver produces a substance called bile, which is concentrated in the gallbladder and released when we're about to eat, aiding in the digestion of fatty foods. Now, what's the link between bile and pain in the right shoulder and surrounding area? Bile is composed of cholesterol and bile salts. When cholesterol levels are too high and bile salts too low, gallstones can form. But before that, an important stage occurs: the formation of biliary sludge, which clogs the ducts and creates pressure, triggering the phrenic nerve. This nerve extends from the diaphragm to the neck, sending sensory signals back to this region. If you look up the phrenic nerve on Wikipedia, you'll see that it controls breathing, since the diaphragm is a muscle that contracts and expands the lungs. However, what many people don't know is that this nerve also sends sensory signals to the neck. Moreover, there is evidence that it connects to the gallbladder and the outer part of the liver. Therefore, any congestion or swelling that enlarges these organs can result in referred pain in this area. This is such a common and easy to resolve issue, but it cannot be treated with surgery, medication, chiropractic, physiotherapy, or massage. It's a purely dietary problem. In fact, it's a bile deficiency. What causes this? One of the main reasons is estrogen dominance, which can occur in women who use hormone replacement therapy or birth control pills. Other causes include medications such as statins, antibiotics, and antidepressants, which can damage the liver and prevent proper bile production. Additionally, excessive consumption of alcohol, processed foods, carbs, sugar, starches, and grains also contributes to this problem. But how can you solve this? First, you need to eliminate those harmful factors mentioned. In addition, there's a powerful remedy called TUDCA, which helps dissolve biliary sludge, reduce liver fat, and benefit other organs such as the eyes, brain, and pancreas. However, often simply changing your diet and adding a supplement called taurine is enough, since bile salts are made from this substance. Now, how do you know if you really have this problem? There's a quick way to find out. You're going to manually massage this area to relieve the congestion. If this is a cause of your pain, you'll feel instant relief in your neck and right shoulder, or even in the scapular region or right arm. To do this, place your hands under your rib cage and press front to back until you find a knot. Hold the pressure there and observe if your right shoulder begins to relax. More than 50% of the time, you'll notice immediate relief. However, the definitive correction comes from dietary changes. If you know someone with this issue or if you have this condition, you now have a powerful tool. Share this information and see if it works for them. There's also a book called Bile Salts in Health and Disease, filled with valuable information on this subject. It's interesting to note that long ago, the role of bile in the body was not fully understood. Ancient Greeks, around 400 BC, studied bodily fluids and used bile as an indicator of health or disease. Only in the 19th century was it discovered that bile could break down fats, much like detergent removes grease from your hands. To produce bile, we need zinc and magnesium as cofactors. But what if you don't have a bile problem? What if you're a part of the percentage who actually suffer from structural or muscular issues? Don't worry, I have a special video for you. Keep watching to learn more about the real causes of neck and shoulder pain. So let's explore a little further how diet can directly influence bile production and, consequently, the health of your neck and shoulders. Imagine that every food choice you make may be impacting not just your weight or energy, but also how your body processes fats and keeps your internal organs functioning properly. When we talk about dietary changes, we're not just suggesting cutting out harmful foods. We're proposing a complete transformation in how you eat. This means incorporating nutrient-rich foods that stimulate bioproduction, such as citrus fruits, dark leafy greens, and fiber-rich foods. These not only help maintain liver and gallbladder health, but also provide a general sense of well-being. Additionally, proper hydration is essential. Drinking enough water throughout the day helps maintain bile consistency, preventing it from becoming thick and prone to forming biliary sludge. Remember, water is a foundation for many metabolic processes in the body, including bile production. But what if you've already tried changing your diet and still haven't seen results? This is where specific supplements like TUDCA and taurine come in. These products are not just temporary fixes. They can play a crucial role in correcting bile deficiencies long-term. TUDCA, for example, not only helps dissolve biliary sludge, but also provides additional benefits for other vital organs. Taurine, being the base for bile salt production, can be a valuable addition to your diet. Now, imagine you applied all these changes and still aren't convinced this is the issue. Don't worry. There are other possible causes for neck and shoulder pain. Some people truly have structural or muscular problems that require specific attention. That's why I have a special video prepared for you. Discover now the secret behind neck and shoulder pain. Like, comment, and subscribe for more valuable tips. But before we go to that video, I want to share a bit more about the history of bile. As I mentioned earlier, the ancient Greeks already studied bile as an indicator of health or disease. They didn't have the technology we have today, but they intuitively understood the importance of this fluid. This shows us that the connection between gallbladder health and neck pain is not something new. It has been observed for centuries. And if you're still not convinced that this is a cause of your pain, try the technique I mentioned earlier. Massage the area under the rib cage and see if you feel relief in your neck and right shoulder. If you notice significant improvement, this may be a strong indicator that the gallbladder is involved. Don't forget to share your experience in the comments. Subscribe now to discover more about the real causes of neck and shoulder pain in our upcoming educational videos. Remember, health is a continuous process of learning and adjustment. As you incorporate these changes into your life, you may begin to notice improvements not only in neck and shoulder pain, but in your overall health. And if you know someone struggling with these problems, share this information. Together, we can help uncover the true causes of these pains and find effective solutions. Keep watching and learn more about how to take care of your health in a holistic and efficient way. In summary, neck and shoulder pain is not always related to the spine, but may result from gallbladder and liver issues. Diet plays a crucial role in this scenario, directly influencing bile production. Nutrient-rich foods, proper hydration, and specific supplements such as TUDCA and taurine can be key to solving this problem. The simple massage technique under the rib cage may reveal if the gallbladder is involved. If you feel instant relief, it's likely the cause. Remember, health is a continuous process of learning and adjustment. By adopting these changes, you may notice significant improvements. But if you're among those who don't find relief, don't worry. We have a special video prepared for you. Discover now the secret behind neck and shoulder pain. Like, comment, and subscribe for more valuable tips. Don't miss the opportunity to better understand your body and find effective solutions. Your health deserves this attention.